I'm a PhD student at the University of Manchester. I've been working with Rowan just because I met him socially.
Hi, I'm Rowan James. I'm a specialist registrar in plastic surgery over at Worcester Hospital in Merseyside, and as a burn surgeon, that's how we came to develop the innovation that's won the award. I was originally contacted by Carl Bamford from TrustTech. TrustTech have been one of our partners in helping to manage how we develop the innovation and how we protect the intellectual property on that innovation, and it was he that contacted me and said, I think you need to go and look at this.
Emergency burns is a translation of a tool that we already use, a pen and paper method for working out how much fluid is prescribed to burns patients. And all we've done is taken that existing, tried, tested, proven method and translate it onto the iPad and the iPhone. And in doing that, we make it a lot easier for physicians to use, a lot more accurate and a lot more convenient just to have in their pocket the whole time. It also means that because it's done digitally, people can keep copies of what they've done, can share that information around, store it for records, pass it on to other people to get consultations and that sort of thing.
At the moment, when a burns patient is seen in an A&E department, the doctors there may only see 1 or 2 major burns a year. And so they're faced with a piece of paper and they've got to shade in where the burn is, and then work out a total percentage of the area that's burned, and then go through calculations relating to the patient's weight, how big the burn is, what time they were burnt, to calculate fluid totals and over different time periods. There are 19 steps from seeing a patient to dialing up a fluid rate on a pump, and with that comes 19 opportunities to have mistakes or problems that are then amplified through the system. So we've done some studies on this which show that when junior doctors are using this, compared to using a piece of paper, as is traditionally done, they are more accurate and significantly safer in the prescriptions that they're writing.
So the interface is pretty much the same as you get on paper. So people who know how to use it already know exactly what they're doing here. You have an outline of a person, exactly what is on a piece of paper, and you can draw in where they're burned. So you can either do that from a physician physically looking at them, or if you over the telephone and you know the exact percentage, you can fill that in as well. And you fill in the parameters of the patients, their age, how much they weigh. If you don't know how much they weigh, you can do an approximation based on their age and up or down a bit. You tell them when they were burnt, and then they prescribe to you how many fluids you should prescribe to the person. And from there you can also email it on, so you can email it into the record store of the hospital or onto another physician to get another opinion.
So certainly for me as a receiving burn surgeon, if another hospital can email me that information, I know what's coming. I've got far more detail about what to expect. When I use it on my iPhone, I get a call at 3 in the morning. We've got a 4-year-old child with a 30% burn. We think they weigh this much, we've prescribed this much fluid, is that okay? Rather than having to sit and do that set of calculations myself, because I can dial up the percentage straight away from this. As soon as they say, well, it's a 30% burn, I can dial that up. I can immediately verify fluid protocols that are being used for burn injured patients. So I'm far happier that things are being run properly, because it is well described of patients arriving in very poor condition because they haven't been resuscitated properly, and it changes their outcome. So it's far safer for patients. It teaches physicians, this is a great teaching tool. How do I assess and resuscitate a burn? You use this. We've got a backup website with a manual that takes people through how to use it as well. So it's not just about patient safety, but it's a good teaching resource as well.
Developing apps is really easy, and the moment you've come up with an idea, if you find someone who's got the technical skills to implement it, they can produce anything that you want. Really, it's unlimited. And from this app, we can take it to so many different directions. We can interface it to hospital database systems, we can build in paging systems to page a consultant. You can do anything you like. If you can think of it, someone can probably program it. All you have to do is find someone who's got the skills to do it, and to talk it through them, and then have the time to make sure it's built up into something that actually works.
So it's the perfect meeting for Chris and I, a clinician with a problem, who understands what that problem is, with someone with the skills who can help solve that problem. And technology now is such that these are so prevalent that we are insane to not be utilising smartphone technology to improve patient safety.
That's excellent. It really is a fantastic. Can I just have a look at it? It's great,
Yeah.
isn't it?
The way to do it is you can scroll by
Yeah.
flicking around, and then to draw you just hold and then touch it and then move around.
So this is being used at the moment.
So at the moment, this is at the stage of going through MHRA regulation to try and get our CE mark, which means we can then go live onto iTunes. It is likely, from what I understand from colleagues related to MHRA, the first UK app to be MHRA registered, and we are just going through that regulation process at the moment. We're waiting to hear back from them. But that's our key to then making it available on iTunes in the UK. If we want to make it available for physicians in the States, we'll need to go through regulation with the FDA as well. And so one of the things that the award money that is so useful for is to help us engage with these regulatory authorities and go through that process, rather than funding it all ourselves. The process was easy, of actually producing this has been relatively straightforward. We were on a wavelength that we worked together to make this thing work. The difficulty now is getting it regulated and out there. Where it's been a number of weeks to make it work, it's taken months and months and months to try and move through the regulation process. And that's because it's not really been done before.
The technology is really simple though. If you were using it just internally, just yourself, you wouldn't have to go through that regulation. So if you've got a good idea and someone can help you implement it, you can have something up in a couple of days, you really can. And there's loads of people who can do this sort of thing. Students in universities who want final year projects, want someone to work on for their masters, they're really keen for that sort of thing. You only have to go and speak to them and you'll find someone who can put something together for you.
It has to be properly regulated. We've got to show that this is safe, and so that's why we've had to do the study to compare paper-based methods with using the app, and it's making sure that it's safe so that it can be used out there. And plus, we've got to manage the liability on that. Here's a product, if people use it, how do we know that they're using it safely? And what do we do if they come back to us and say there's been a problem with the patient having used this? These are the difficult things that we're trying to overcome and tackle, that have been far more difficult than producing something that works and does the job.
It's no different really to the piece of paper, that method. It's just because it goes on an electrical device, it suddenly gets classed as that medical device class, the same as any piece of medical equipment. It's not quite the same as that, so that's why it's a bit of a stumbling block and a bit frustrating sometimes just trying to get through it.
It's really the only people we've utilised outside of ourselves, although there have been support within senior members of our department, my clinical director Paul MacArthur. Really it was he and I that said we've got this problem to solve, and going to Chris with it. Outside of that, it's been TrustTech who've helped us manage the intellectual property, and it's now we're looking to move and use help from within the trust, or even turning to HIEX to look at making sure we move through the regulation and all the rest of it smoothly.
You don't need funding though. If you find someone who's got the skills and can do it as part of the project, you don't need a lot of money to do it. If you went to a consultant and said I want to build this app, who'd be charging you tens of thousands of pounds, that's not necessary at all. You really can put them together fairly cheaply.
I knew the existence of HIEX, but hadn't sort of obviously interacted with them before, or necessarily properly understood what they were setting out to achieve as an organisation, until I've come today and spent time at the conference to sort of understand that a lot better.
Yeah. Yourself, Chris, did you?
I wasn't aware of it, no. I completely come from a technology background, so I've been going through Rowan for all that support.
Yeah.
Well, there's two aspects to that. Today, meeting people and talking to them about this, and potentially finding other people who can help us develop it and move it forward, is enormously helpful. Secondly, having been given an award for innovation gives us further levers, I think, on the regulation side to help us demonstrate that this is a good quality piece of work that's aimed at patient safety and efficiency. And it helps us, it opens doors to us to talk to people more about developing this, because we are coming as an award-winning app.
Every professional you speak to has got some good idea about what else could be done to make their particular life easier. And with a bit of extra time and money, you could implement so many of those ideas and make it happen, make life easier for all these people. There are so many people looking for problems, undergraduates, universities, and I was about to start my PhD, and one of the reasons I did this was to get something to say I'd done in my own time. And I was searching around for an idea, something to make, and when I spoke to Rowan, he said, I've got this new idea of doing this. It was perfect for me and it's perfect for Rowan. And there's so many other people like me looking for something to develop.
It's out there, something called a Giebel round. You come across it's a German word, and at the minute they were doing that in Wales about 4 or 5 years ago, where they were pulling together industry people in the same room as clinicians with a problem, and say, sit round a table, present the problems, and we'll look at people who might have the ideas to help solve them, and bring people together in exactly that forum. And we need to do more of that to look at this, particularly informatics. Health informatics is such a problem. And yet there are some bright young things out there who can solve it.